Response, factors, and effects of stress.
Psychological responses to stress. How do you know that you are stressed? Stress is a mixture of both biological reaction and psychological responses. The flow of hormones in the alarm phase, which is the biological reaction of stress, attended with feelings of fear or anxiety, which is the psychological response. In the resistance stage, where you feel tired and force yourself to move on with your life, people may 1. Easily forget stuff, 2. Have tendency to get excited, angry, or upset easily, 3. Poor concentration, 4. Little motivation, 5. Low productivity to finish tasks, 6. Change in moods. During the exhaustion stage, feeling drained and having no energy, depression and withdrawal may occur. Some people exhibit illogical behavior and use drugs and alcohol. Cognitive effect of stress. The top level of stress is different from one individual to the other. The increased response to stressor is sometimes called arousal. The Yerkes-Dodson law talks about the relationship among the level of arousal, performance, and task difficulty. When someone is about to take a test, their attitude may vary from not caring and excessive concern and anxiety. The best performance would be if their attitude is between those extremes, that is, caring about the test but not overly concerned. Having high arousal level would make them have difficulties in concentrating, while solving a difficult test with a low arousal result in having better performance. Factors that influence stress. Personality. People who don't restrict themselves and try new things is a huge personality trait. Some people look at change as a challenge but others as a threat. People who look at change as a threat more likely to deal with negative stress responses. Stress tolerance. 10% of the population have low stress tolerance, the inability to deal with stress that most people handle with few or no problems. Perception of control. Some people see daily life irritation as overwhelming because they believe that they are out of their hand to control. Others choose what gets and what does not get to them. The more control you have on yourself, the healthier response stressors. Self-efficacy. Individuals who believe that they are capable of achieving what they set out to do are less affected by stressors. Research has shown that self-confidence can reduce adrenaline levels in the bloodstream in potentially threatening situations. Social support. People with a surrounding support system like friends and family are less affected by stressful situations.
And now for my favorite part. Time for an activity!